This is lecture 6 of research method. In this lecture, I will talk about interpreting the results. When you as a researcher want to describe your results, this description of the results should be clearly and in a way that allows others to compare their results with your results, and also you should use appropriate statistical methods and interpret the results objectively and in a critical way. That means not only highlight the positive sides, but also the negative sides, which are the limitations. All these should be done before drawing implications of your results and the conclusions. Interpreting descriptive statistics. From previous lecture, which is about normally and not normally distributed data. In case of normally distributed data, which is this, all the measures of central tendency, mean, median, mode, can be used in the same way. However, the most powerful one is mean. But when we have not normally distributed data like this, which is called positive skewed data, or this, which is called negative skewed data, in this case, mean is most affected measure of central tendency. Therefore, we should rely on median or mode. In case of nominal data, we can use mode because we are looking for the most frequent result. While if we have ordinal data, we can use mode and median, especially median because we are looking for a measure of central tendency or the middle value. In all cases, when we have normally distributed data, mean and the standard deviation can be used and commonly used. And if we have not normally distributed data, we can use median and interquartile range. Always, your results are not talking about normal values, so you shouldn't describe your mean and the standard deviation as a normal value and range, because when you want to know the normal value of any disease or any result, you should have very large number of healthy people. Also, in your descriptive statistics, you can use this sign, which is plus minus. This could mean standard deviation or standard error. Therefore, you should clarify this from the beginning, either by using a note saying that this sign means standard deviation or standard error, or you can write it like this. Now interpreting statistical significance. When testing the hypothesis, we always state a null hypothesis, which is saying that there is no significant difference between the groups. So our result either with a p-value greater than 0.05, that means there is no significant difference as the null hypothesis, or we have a p-value which is less than 0.05, and in this case we should declare a significant difference between the two groups. If we have a non-significant difference, that means we are with the null hypothesis, but it's not true to say that we accept the null hypothesis, because accepting the null hypothesis means or needs an infinite number of tests in order to accept the null hypothesis. If you find no significant difference, someone else may find a significant difference elsewhere. So it's better to say that there is insufficient evidence to reject the null hypothesis, which is the same meaning of accepting the null hypothesis but in a conservative way. But if you have a significant difference or p-value less than 0.05 in one test, you can say that you will reject the null hypothesis. You should also differentiate between statistical significance and the clinical significance. Statistical significance is only related to the statistical test, while clinical significance is related to the effect of your result clinically and its implications. Sometimes you may find a statistical significant result, but they are not clinically significant, and vice versa. So you may find a not statistically significant result, but they are clinically significant because the difference is great or large, but due to small sample size, these effects cannot be detected statistically. Therefore, always look at the clinical significance more than the statistical significance. The word significant is only related to the statistics and it should not reflect the importance. It's a good to practice using both p-value and confidence interval because confidence interval is the range that can show you the difference between your groups. Therefore, your clinical difference is related to this range. Always remember that you have two types of error, type 1 and type 2. Therefore, your results are not absolute. You have a degree of errors always. Also use a common sense when interpreting your p-value, because a p-value of 0.051 is referred to non-significant statistically, while a p-value of 0.049 is referred as statistically significant. So, what is the difference between these two values? Consider that you may have some problems or some other factors like problem in sampling. Therefore, you always have an element of uncertainty in your p-value. When you interpret the results that related to drugs or treatments, always consider safety, tolerability, efficacy, and the price, because they may affect the decision about which one is the best. If your sample is not representative to the population, that means all your results are misleading, and or the inferences that become or outcomes from your result will become misleading. Generalization of your finding can be associated with increasing the sample size, low variability of your results, and using study or proper study design and method, especially the sample selection. When you are using correlation coefficient test, you are looking for a relationship between your variables. This is usually confined between -1 and +1. 0 means there is no relationship between your variables. Positive relationship means there is increase in one variable and increase in the other also. 1 means there is a perfect positive relationship. Negative relationship means when one variable increase, the other will decrease. And -1 means there is a perfect negative relationship. This is only related to the relationship between variables, and it's not about cause and effect relationship. Bias and confounding. There are two types of error. These are bias or systematic error, which means any undesirable feature in the study that tends to produce results which are systematically different from the real values. Usually bias has a direction that is either increases or decreases the estimate or the results, while random error occurs due to chance, so it doesn't have a specific pattern or there is no direction. Bias cannot be addressed or corrected by statistics. It's very difficult to avoid bias completely, but it's possible to limit the bias and the problems related to bias on the results by eliminating the potential bias early in the planning stage or during writing the protocol. In case of systematic error, you have something wrong in your principle of measurements that lead to results which are either increased or decreased or directed in one way. But in random error, you may not have any problem. It's just related to chance and human error. Another example, when you are measuring on a scale, this is the correct position of the measurement, but sometimes may be related to some errors. For example, you are not seeing the number accurately, so you are committing an error, which is a random error. But if you are taking this position, all the results may be overestimated. And if you are taking this position, all the results may be underestimated, so you are committing a systematic error because you may not know how to measure accurately. So both this and this lead to direction of your results either in positive or negative way, so these are systematic error. We should also consider the effect of confounding variables, which are any factor that is not related directly to the aim of the study but can affect the outcome, or the dependent variable. If you remember this example, when we are looking for the effect of smoking on the lung cancer, age may be another confounding variable. And the same for the effect of alcohol on coronary heart disease, smoking may be a confounding variable. Therefore, we should control these confounding variables, otherwise our results may be related to the confounding variables, not to the exposure factor. It is difficult to know all the confounding variables and control them, but it's better to minimize their effect and avoid their effect. And the best way to minimize the effect of confounders is by randomization of the sample, especially in clinical studies and when you are using clinical trials, because in randomization you are distributing the effect of confounders between the groups and hopefully this will happen evenly. But when you don't have randomization, like for observational studies, you can use matching groups when you are matching your groups according to these confounding variables like age, sex, ethnic groups, or smoking and other confounders. Sometimes you can stratify your analysis by dividing the samples into groups and analyze them in the analysis stage. Common types of bias. First of all, we have selection bias. In this case, the intervention groups showed systematic difference in the baseline characteristics. For example, when you assign patients with better oral hygiene to the treatment groups that you favor, so you are creating a selection bias because you are making one group is better than the other. This can be prevented by adequate randomization, because in this case you don't have a chance to select your people in the favored group. Another type of bias is study management bias or performance bias. This happened when there is a systematic difference in the care provided between the two intervention groups. That means when you follow more closely the patients in your favorite groups and compared to other groups. So you are creating a difference in the care providing or in the management between the two groups. This can be prevented by blinding, so you don't know which group is which, and by standardization of procedures, or when you have a fixed protocol of treatment for the two groups. Detection bias. This happened when there is a systematic difference between groups in how outcomes are determined. For example, when you are recording your outcome in a way that follows your interest, especially when you are using rounding up or down for the results. Again, this can be prevented by blinding, so you don't know which group is which, so you don't have a chance to modify the results. Attrition bias is happened when you have a systematic difference between groups in terms of withdrawal from the study, or when you have incomplete outcome data. This usually happens when there is a side effect in one group greater than the other group. This can be prevented by accounting for dropouts when you are calculating the sample size and by using intention to treat analysis. Usually this is in randomized clinical trial, which allows you to account for the missing data. Publication or reporting bias is the systematic differences between groups in reported and unreported findings. For example, when you are selectively reporting only the significant differences and leave the non-significant differences. This can be prevented by trial registration. In case of clinical trial, the trial should be registered before the beginning of the study. Therefore, anything that you need to report, it must be reported at the end. Also, pre-publication of trial protocol. This can be published before the study, therefore anything written must be reported at the end, and reported not only the interest or positive results, but also the negative results. This is the end of lecture 5. Thank you.